Hello, Dr. Potter here, helping women to brighten moods and balance hormones so they can worry less and enjoy the magic of motherhood more. And today I am so excited to have Krista Kahmann on the live interview with us today. You are in for a real treat because the power of touch and body work and massage in this time after giving birth is so powerful. And Krista is just going to share about that with us. She is a massage therapist here in Portland, and she has an amazing podcast called So You Had a Baby Podcast. And her and I have been, let's see, she interviewed me on the podcast a few weeks ago. We have had some conversations, and it is such a joy, and it's so refreshing to talk with Krista because she just completely gets it. This whole postpartum ups and downs and the craziness, and also this amazing support that needs to be wrapped around mothers. And she is one of the people here in Portland that is working on that. So welcome, Krista. Thank you so much for being here.
Thank you. That's a really amazing introduction. I am honored to be here. I am excited to be able to be here with you because you put a lot of energy and work and love into what you do. And it's just really refreshing to know that there's lots of people out here doing that. So
Yes, I know. And now here we are talking to you who are watching live. And so you can know that these are some great resources for you.
absolutely.
So, Krista, let's get started. Tell us about your practice.
All right. So my name is Krista Kahmann, as you said, and I am a licensed massage therapist as well as a certified infant massage instructor. My business name is The Woman First, and I just have a lot of passion and love to be able to pour into women in that pre and postnatal phase. I work with women in all phases, obviously, but my real passion is really focusing on women in that pre postnatal time. So
Beautiful. And, this is a particular niche in the massage world. So tell us what got you into supporting women prenatally and postpartum.
well, to be really honest, when I started massage, I was really interested in sports massage. And that's the original path I thought I was going to be going down. And I got pregnant and had a baby. And in my own postpartum phase, I just realized there was not a lot of attention. As anyone who's had a baby, you get one appointment, 6 weeks postpartum, and that's kind of it. And in my own struggles, I just realized I wanted to be part of the solution and really pour into women in the space because it's it's just there's not enough attention in this really pivotal moment in a lot of women's lives. And so I just kind of changed everything I was doing, and I went and got certified in pre and postnatal. I just because I wanted to have more confidence really working with women in that phase. And then I also decided that it was important to get certified in infant massage and as an infant massage instructor, primarily because my daughter was breastfed only. She refused to take a bottle. I dealt with the extra enzyme, lipase enzyme, which made my breast milk taste sour. And so that was kind of a struggle then. We now know what to do. But because of that, my husband didn't really get to have that bonding that I felt was really important. And that was hard for him. And being able to teach infant massage gave me this tool to be able to provide partners an opportunity to bond in a way that didn't deal with feeding or, breastfeeding or bottle feeding, and really get to learn your baby in a really beautiful way and empower the parents to know that they are the experts in their own with their children. And also in doing my own research and talking to other moms, I learned that there's so many women that don't have that immediate bond with their baby. And it's really normal for that to happen. It doesn't click right away for a lot of women, and that's perfectly okay. Or depending on how you choose to feed your baby, if you decide you don't want to breastfeed or you can't breastfeed, to be able to offer this other tool that's really powerful and beautiful, that you feel like you get to bond in another way that moves beyond breastfeeding. I wanted to make sure there was other options and other ways to empower parents, because I feel like you hear it so often, but women leave the hospital and parents leave the hospital thinking, am I really, are you sure you want to let me go? Do I really know what I'm doing? And so just to have this tool that you can teach this powerful, teach parents to feel more confident in what they're doing, I just thought was really necessary and an important part of what I wanted to be able to offer.
Oh, Krista, that is so beautiful because that's such a struggle for lots of families to, that bond for, the partner who's not doing the feeding or even the mother who may not be able to breastfeed. Like that can be really heartbreaking. And so, that's just like wonderful to know that there is like doing this infant massage can really be that bridge to
Yeah.
help with that bonding if you're not able to do it in a way that you had expected.
Mhm. Absolutely.
Yeah. And so I also want to ask you because I know a lot of people are probably thinking in their minds, like, awesome. I am so supportive of massage, but I am worried about going to see a massage therapist right now during COVID.
Mhm.
And I know that you told me about what your clinic is doing right now. And it's amazing how you guys are setting up safely for COVID to help people come in. So can you just share with people what you're doing to help kind of ease people's minds?
Yeah, absolutely. So the clinic that I work in is really, really proactive and immediately took the steps to make sure all of our patients were cared for and felt safe coming in. Um, we have a thermometer set up before you even walk through the door that checks your temperature, that is touchless. You just kind of lean into it. There's barrier walls between you and all of the staff. We limit the amount of people who can sit in the waiting room. We've kind of changed our appointment schedule so that I have a 15-minute gap between each one of my appointments now, so that we have opportunity to do a really thorough sanitizing everything down. We require every person who walks into the building to be wearing a mask. Our practitioners all wear masks and are really on top of policy and procedure. And just our main focus is to make sure that when our patients come in, we really take the time to care and know what's going on. We ask that, you don't come in if you're feeling sick, obviously, and we honor that same rule. It's really refreshing to be able to go to work and know that everyone I work with and all the practitioners are in my building feel um, put just as much energy in making sure our patients feel safe and cared for. So,
Oh, that's fantastic.
mm,
And you, as the practitioner going into a building with other people, and you're a mother as well. So it's not like you want to be doing anything that's bringing, anything home, whether it be COVID or any like flu or colds. And so that's wonderful that like you and all these other practitioners are there because you've set up these guidelines. So yeah,
mm,
thank
absolutely.
you. And yeah, if anyone had that question in their mind, I wanted to set that out because I know that you've been doing massages, which is great.
Yeah, and I think it's an important thing to address these days, because you want to feel comfortable getting the care, and more now than ever, you said this before, you need that care. And I feel like my job as a massage therapist, especially for moms in the space who don't have access to a lot of the things they would normally have, that care is so important, and that touch is so important for healing, and so many other reasons. But it makes me really happy to be able to show up and be able to still do what I love and care for these women in this space.
Yes, yeah, because women who have really young babies right now during this like quarantine time and the pandemic
Mhm.
are experiencing a very different and a lot more stress. And it's hard, particularly because of that isolation. So thank you for being here and having your services open.
Yeah, absolutely.
Yeah. And I just want to say a quick hello to Danielle Marie, who popped on here and said her kids are 2 and 3 and 1. You are a busy mama and your back and knees are bad. Yeah, that's such a common complaint.
Mhm.
So let's, yeah, talk more about motherhood. And through your experience seeing lots of clients over the years, what have you seen are the biggest struggles that moms experience with their bodies after birth?
Um, in terms of their bodies, honestly, the two most common things that we see for a lot of new moms, um, new postpartum moms specifically, are low back and um, hip issues, as well as shoulder issues. One of the things I say, I feel like I hear from any woman who's coming in, whether like, especially who just gave birth, is my neck and my shoulders are killing me. And I always say, well, nursing neck or feeding neck is a real thing. this this sweet holding position where you just want to stare at and adore your child leaves you with a really elevated shoulder and a really crooked neck. And unfortunately, as moms, we know that we will do anything to make sure our baby sleeps and so that we can get a moment of rest as well. And a lot of times, what happens is we completely compromise our body mechanics while we're doing that. And though I can completely relate because I know I did this as well, it's something that we have to educate, and I work to educate my clients that come in that your baby sleeping is important, but your body mechanics and you being able to take care of your body is really important so that you keep doing what you're doing. Um, and again, the as I said, low back issues are something I see regularly, and that is for so many reasons. Relaxin through your pregnancy softens your tendons and all that cartilage, and so things are kind of feeling a little bit more loose. You gain weight in your pregnancy naturally, and your breasts get bigger and your stomach gets bigger, and that weight that's adding on top of you, on top, as well as your body, your position and your posture totally changes. Your hips start rocking forward and you get an anterior pelvic tilt, and your glutes have to start working a lot harder to balance you, and all of these muscles start firing in different ways to support this new body. And after we give birth, your body shifts in a whole different way and you're spending a lot more time sitting, and your hips start to feel a lot tighter, and that can pull on your low back and cause a lot of, the way I always say it is, it's a ripple effect. When one thing is off, everything else has to slowly start compensating. And so those are the two things I usually work a lot on new moms as well as pregnant mamas. Honestly, I feel like those concerns are the same in both pregnancy and postpartum. So
Yes, I mean, that's such a good reminder about the power of massage during pregnancy because you really are adjusting so much to your growing belly and the added weight and stuff. Just, your whole body feels different. And so you walk differently, you hold your back differently. And so those, postpartum back issues could actually be at least like supported during pregnancy. And the more support you can get during pregnancy can support you in that postpartum time.
absolutely. Especially the other thing I was going to say is once you're late in your pregnancy, baby drops and drops really far into your pelvis, which means your legs have to turn out a little bit more to support your belly sitting lower, closer to your legs, lower in your pelvic floor. And so everything kind of rotates out, including, your hips rotate out as well because that relaxin and those piriformis muscles, as everyone's really familiar with the sciatic pain, those really start to fire up because they're constantly flexed. And so taking some pressure off those muscles and in and around your hips is really important so that you can be comfortable and after giving birth and during. You don't have to be in pain in pregnancy and deal with it. There's ways to care for your body. So
Yes, I know. And that's just such an idea that we have, like a myth of pregnancy, right? Is that, oh, you're pregnant. So, of course, you have like this really bad hip pain and you can't, you do that waddle. And of course, when your baby drops, like you're going to be adjusting. But there are ways to be working with muscles to help you actually have a really a stronger core, a stronger gait,
Mhm.
to help you with those things that are seen so often as just like, oh, well, you're pregnant, so you just got to deal with that.
Yeah, exactly.
Yeah. So let's get into this just a little bit more of like, why is it important to get body work done after giving birth?
There are so many reasons why it's important to get body work. I mean, first and foremost, self care. I don't think I can say this enough, but as a new mom, your ability to or focus on getting self care kind of goes out the window. All of your attention starts going towards keeping this baby alive naturally. But I say this all the time, but you cannot pour from an empty cup. You can't give of yourself every day, all of you, which you do as a mom, um, and not ever put back into you. You're gonna run dry eventually, and it's hard to do that. So first and foremost, self care. Yeah, on top of the fact that there you can reduce your stress hormone, it improves circulation, improves joint mobility and muscle flexibility. I mean, I could go on and on as to why it's important to get body work. And one of the things I like to tell people is I feel like when you think of massage, a lot of times people will think of it as like a day at the spa, going in,
Mhm.
getting this nice, relaxing massage, and leaving, and just it just being a really relaxing experience. Those are important, but I consider myself more as a therapeutic massage therapist who focuses more on, you know, helping you be the best version of yourself muscularly and be able to have more range of motion and mobility and really be able to be in your body and be comfortable. So that sometimes means breaking down that muscle tension and that adhesion and that fascia that's kind of sticking and not allowing your muscles to glide over each other the way they're supposed to. And when those muscles stick, you kind of feel it everywhere. You start compensating in a lot of ways that you start thinking as normal and you just kind of have to deal with. So I like to sit down when I have a new client and really figure out what's going on, how are you feeling, and how is it showing up, and then addressing the issue that you're showing up for, but really trying to take a deeper look at the root cause as to what's going on and where it started from. Because just because your shoulder hurts or you're starting to get migraine headaches, or it really could be because of the way you're holding your shoulders and you have been for the last year and you didn't realize you were doing it. So really tapping into these patterns that you've created and breaking that down and retraining your muscles and teaching your muscles how to move again. So
Yes, that is right, because during that pregnancy and even postpartum, when you're doing the feeding and just you're like struggling with your body, you're training your muscles to do it in a certain way, which is then like leading to pain, but then we have to retrain them, which is what you're doing with mothers. So that's really beautiful.
thank you.
And I love what you're saying about how, like, it's hard to think, like, okay, massage is this self care and it's going to be like a whole day. I have to set aside a whole day at the spa, right? But massage for postpartum has been done for centuries. Like, it's been a part of, traditional postpartum healing practices in many different cultures because they notice the power of touch and the power of massage to support a woman who's healing after birth. And so it's a pivotal part of healing for women, and yet we've lost that art, and so we really need to bring it back. And so
Yeah,
going to get a massage is a very important part of your healing process.
absolutely, absolutely. And I'm glad you said that because it really is a cultural thing for a long time. That immediate postpartum care and pouring into your body is something in a lot of other cultures that is just expected. And unfortunately, we've kind of lost touch with that. I feel like, especially in the US, we expect women to jump right back into doing everything they were doing before. And we don't take time to honor that phase and that healing that needs to happen. And so I love working with prenatal women. One, just such a beautiful phase and really honoring their body, but also so many women make the time in pregnancy to get massage and to get care and don't carry it on in postpartum. And so meeting women in that pregnancy phase is really wonderful because I get an opportunity to really educate as to why it's important to keep doing this. It's not, I always say you need it now and you feel like you need it now, but you're going to need it more. So, and I always tell people, book your first postpartum massage on your last time I see you pregnant, because
Mhm.
then it's already there. You have the expectation set and you know that I'm going to do this because I need to. And you kind of set that standard for yourself of how you're going to care for yourself moving forward. And if you don't and you neglect that, you feel it and it starts surfacing in lots of other ways. So making that time, and I know this is hard, but especially as a mom myself, immediately postpartum, you don't want to leave your baby and they need you every 2 hours, but you only need an hour for a massage. And so if it means that you ask your partner to take over, then you rely on your partner, and that's why they're there. If you have that help, ask for it, because I think there's a lot of power in being able to ask for help so that you can care for yourself. And when you set that standard in the beginning, you kind of make a promise to yourself, but also then your partner sees that you have that is something that you're dedicating to, and they'll follow suit with you. And honestly, I feel like you hear this so often, but your partners want so bad to help. And moms in that phase it's hard to give up this new, power, if you will, but it, to, it creates this really wonderful bond for you and your partner to be able to give them, the baby and say, I'm going to step away and let them have their time too. There's a lot of benefits that come with making time for yourself.
Yes. Yeah, that's great to remember how to ask your partner for help because it is so difficult. And sometimes you, as the mother, don't even really know how to be asking for help or what you can need. And so, just like a little bit of time can be extremely helpful.
Yeah.
Hmm.
I'm not doing it currently, but I normally will do in late postpartum or late pregnancy, early postpartum, I do in-home visits for clients who I've met already. And honestly, I love being able to provide this service because, for someone who's bedridden in pregnancy, or I just know it's hard to get out, and it's nice to be able to have that service in the comfort of your own home when you don't have to leave in that early postpartum phase. It just makes it so much easier. And I also tell people, bring your baby. If your baby's really little and it's hard to leave, bring them. Crying doesn't bother me. I've had enough of it in my life. So I know what it sounds like. And, if need be, you need to put the baby on the table and breastfeed him, then I'll put you into sideline and you can breastfeed while you're getting a massage. Like you can get care still with baby there. I know I've done, at one point I did a home visit and the baby was so fussy and just kind of sitting next to us. And I would go and adjust the baby here and there and help, just so that she could relax. And the baby just was not having it. So at one point she got up, grabbed the baby, sat down in a chair and breastfed. And I just worked on her back and the areas that I could access so that her massage didn't have to end, but she was still getting the care she needed, you know, while she was breastfeeding. I mean, breastfeeding is so normal. We can throw it into a normal routine if we need to.
Oh, that is wonderful. How, yes, it is hard to take that time to make the appointment, to go in to get that care, but you are just very supportive for bringing babies in and to, once the pandemic is over, going to mothers' homes and helping women make it so that it's easy and that they can get this time. That is wonderful.
Yeah.
So, how can people book an appointment to come and see you? Tell us how to find you.
So my business name is The Woman First. You can find my website, www.thewomanfirst.com. And I practice at Evolution Healthcare and Fitness. And you can call. I have all the information on my website as well. And you can call and book with me through that service or through them. And I'm at 905 Southeast Ankeny Street in Portland. So
Great, nice and central.
yeah. And then you can also find my podcast at So You Had a Baby. You can find me on Instagram at So You Had a Baby podcast. Um, and or you can find my website at www.soyouhadababypodcast.com.
Wonderful. Okay, I popped those links into the comments here so that they are there. Well, Krista, thank you so much for this amazing work that you're doing and for being here chatting with us today.
Yeah, thank you so much for having me. This was fun.
Oh, good. You're welcome. Have a great afternoon.
Thanks, you too.